Welcome to Best Training. In this short opening, we're introducing CHCECE032 Nurture Babies and Toddlers as part of your Certificate 3 in Early Childhood Education and Care. In this unit, you'll learn how to build trusting relationships with babies, toddlers, and their families from the very start. The focus is on children from birth up to 23 months, where care needs are constant, communication is developing, and every interaction matters. You'll support daily routines like sleep, feeding, comfort, hygiene, and toileting in ways that protect well-being and help children feel secure. Just as importantly, you'll do this under established policies and procedures used in regulated children's education and care services across Australia. A big part of this unit is learning how to form respectful, responsive relationships with babies and toddlers so they feel known, safe, and supported. You'll also work in partnership with families because good care starts with listening carefully, sharing information, and respecting each child's routines and preferences. Safe sleep is another core area, along with creating calm rest routines that follow service requirements and current safe practice. You'll practice positive nappy changing, toileting support, and mealtime routines that protect dignity, hygiene, and emotional comfort. And across all of it, you'll help create a healthy, safe environment where babies and toddlers can explore, connect, and develop with confidence. To complete this unit, you'll need real experience with 2 babies under 12 months and 2 toddlers aged 13 to 23 months. With babies, that includes tasks like nappy changing, preparing bottles, feeding, supporting solids, and settling children through sleep routines. You'll also need to notice signs and cues, respond appropriately, and adapt your care to each child's needs, comfort, and stage of development. For toddlers, you'll support toileting, help with routines, and encourage age-appropriate movement, exploration, and gross motor development. These aren't just tasks to tick off. They're the everyday moments where nurturing care, safety, and responsive practice really show. Think of the baby's room as your learning environment, where routine care becomes evidence of professional skill, judgment, and respectful relationships. There are some essential placement conditions you need to plan for early, and one of the biggest is access to a baby's room in a service or childcare center. You'll also need to complete at least 160 hours in a regulated children's education and care service in Australia. During that time, your practical tasks must be supervised and observed in line with assessment conditions. That observation may be carried out by an approved educator, an assessor, or a workplace supervisor, depending on the task and the assessment process. What matters is that your practical performance is seen in a real service environment, not just described in theory. Alongside your practical skills, you'll need a solid understanding of the knowledge that guides quality care for babies and toddlers. That includes safe sleep, attachment, development milestones, and the ways babies communicate their needs before they have words. You'll also need confidence with hygiene, infection control, feeding practices, food safety, and supporting breastfeeding appropriately in the service setting. Handling formula and expressed breast milk correctly, recognizing allergies, and supporting oral health are all part of safe everyday care. You'll also be expected to communicate professionally with families and help maintain environments that are safe, healthy, and developmentally appropriate. This unit is hands-on, and yes, it asks a lot of you. But it's designed to help you grow into confident, capable practice in a real early childhood setting. The best way to stay on track is to be organized, ask questions early, and make the most of every opportunity in the workplace. Keep reflecting on your interactions with babies, toddlers, families, and colleagues, because thoughtful reflection helps turn experience into real competence. As you move through CHCECE032, remember that Best Training is here to support you at every stage of the unit. If you need help understanding the requirements, organizing your evidence, or preparing for assessment, please contact the BEST training team.